Good morning, everyone, and I'm delighted to be here today at this important event in the Health and Social Care calendar. I would like to extend my thanks to Angela McLernan for inviting me to address you today. As today's programme was appropriately titled, 2020 is the International Year of the Nurse and Midwife. This is an ideal opportunity to celebrate your achievements and contributions to our health service, to pay homage to the selfless work carried out by nurses and midwives across the country, but also the time for my department to outline its plans for continued investment to nursing and midwifery throughout Northern Ireland. Today, it gives me great pleasure to be launching the Nursing and Midwifery Task Group report, copies of which will be available on my department's website shortly. This task group report points the way to a new era for nursing and midwifery here in Northern Ireland. And I'm delighted as Health Minister to not only welcome its publication, but to commend its findings in this, the International Year of the Nurse and Midwife. I want to say we owe a debt of gratitude to nurses and midwives right across Northern Ireland for their commitment, their dedication, their expertise, and particularly given many of the challenges that you have faced over the last number of years. Today, as your Minister, and on behalf of the people of Northern Ireland, I want to say thank you to you all for the work that you do. I also want to say particular thanks to Sir Richard Barnett for his leadership of the Nursing and Midwifery Task Group, and all of the members of the NMTG for their important contributions. Sir Richard will shortly be speaking to you more about the report, because this report, I believe, sets out the critical issues facing midwifery and nursing, and does so within the context of the health and social care needs facing our population over the next 10 to 15 years. Along with restoring pay parity, I have endorsed most of the report's recommendations, and I have asked the Chief Nursing Officer, Professor Charlotte McCardle, to oversee their implementation. I must emphasise that the speed of implementation is entirely dependent on the budget settlement that is not yet agreed. However, in relation to recommendation 7.2.6, while I fully appreciate the sentiment that's underpinning this, and why we make better use of the tremendous skill set of experienced nurses, the report does not yet provide me with sufficient detail as regards how such an approach could work. Therefore, while I'm unable to accept the recommendation as written at this time, I am commissioning further work to establish the detailed evidence base for the costs and benefits for such an approach. I also want to take this opportunity to pay tribute to my Chief Nursing Officer. Since taking up the role of Health Minister, I have witnessed at first hand her tireless leadership in advocating for the people, including the role nurses and midwives play in addressing the health and social care needs of our population. I'm committed to maximising the contribution of midwives and nurses at all levels of our healthcare system, but in leadership and in advanced clinical roles, both in leadership and advanced clinical roles. It is my belief you have a central role to play in transforming our health and social care system. You will see in the report a number of key ambitions in order to address the challenges going ahead. You will see the report identifies a number of key strategic priorities which will seek to do three key things. The first is to stabilise the nursing and midwifery workforce to ensure safe and effective care. My department has increased the number of undergraduate places from an all-time high of 1,025, with a commitment in New Decade New Approach of an additional 900 over the course of the next 3 years. In addition, I am committed to implementing all of the delivering care phases completed to date. I have secured an executive commitment of £60 million over 5 years to fully implementing delivery care. The current nursing and midwifery safe staffing policy. I have asked officials to work with the Chief Nursing Officer and trade union colleagues to bring forward work to set out the detail for safe staffing legislation. The second point, strengthening the role nursing and midwifery play in population and public health planning, is also key. Part of the extra funding for delivering care will strengthen public health nursing. In addition, the Public Health Agency will bring forward a new public health population health, nursing and midwifery framework. The third point will be enhancing the role nurses and midwives play within multidisciplinary teams as part of the wider transformation of the health and social care system. As an early indicator of my commitment to support the role of nurses and midwives, I have committed to growing the postgraduate nursing and midwifery education budget to 11.25 million by the year 2022. This represents an additional investment of over £4 million, and this will enable the Chief Nursing Officer to further develop postgraduate specialist and advanced nursing and midwifery practice and roles, as well as further development for the profession. You will also note today, again as a demonstration of my commitment to each of the recommendations, I will be launching a costed implementation plan. The delivery of these financial commitments are obviously subject to the overall funding package available to the Executive for New Decade, New Approach, the challenges of which have already been discussed in the Assembly, and subject to the overall settlement of the Department of Health, but I remain committed to finding those necessary resources, not least by doing things differently in our health service through transformation, but also, hopefully, with the ongoing support of my executive colleagues. In conclusion, this report provides a long-term vision for the profession. That vision involves nurses and midwives at the very heart of care and innovation at all levels within the health service, as the clinical experts, healthcare leaders, public health champions, researchers, teachers, and digital specialists. It is a future we can all be excited about and take pride in. And once again, ladies and gentlemen, can I thank you for the role you play in our health service. Thank you.
When I met the Minister a few weeks ago to brief him on this report, he was extremely receptive to our recommendations, and it is clear that he is committed to creating the conditions required to address the challenges facing the nursing and midwifery professions, and to do so in ways that facilitate the transformation of the health and social care system. So I want to thank the Minister for his positive response to our recommendations. This, I believe, is deeply encouraging for every nurse and every midwife in Northern Ireland. I also want to echo the Minister's words in acknowledging the diligent and tireless work of our Chief Nursing Officer, Professor Charlotte McCardle. We are fortunate. Charlotte has a clear vision and a deep desire to maximise the contribution that every nurse and every midwife makes to the improvement of health and social well-being. Finally, in these introductory remarks, can I thank every member of the task group. Every member of the task group made invaluable contributions to our work, so thank you all. And I know that the other members will understand if I pay particular thanks to Rodney Morton, who at the end of our process, towards the end of the process, collated a lot of the disparate parts of our work. It has been an absolute privilege to have chaired the Nursing and Midwifery Task Group, and I want to thank the previous Health Minister, Michelle O'Neill, for affording me this opportunity. From the outset, I have been humbled by the work of nurses and midwives and the amazing contributions they make to the lives of people across the life course every day. We took a co-production approach to our work, and some of you may remember that co-production approach started in this hall a few years ago now, when there were yellow stickies around the hall at the end of the event. And during that co-production process, we've met some 1,000 nurses and midwives. They all had one thing in common. They deeply cared about people. They wanted the time and they wanted the space to do their jobs to the standard that they wished. And they wanted the training to take on the extra responsibility that they recognised was required. They are, in my opinion, true advocates of the champions of the human experience. It is apt that we are publishing this report in the International Year of the Nurse and the Midwife. Now, at this point, I have a quote from Sir Michael Marmot. The only thing is that Catherine has already used that quote, Charlotte has already used that quote, so I could now test you on what that quote says. But in that quote, you'll be aware that Sir Michael says that the nurses and midwives are, and I think Martin referred to it as well, if not directly quoted it, but nurses and midwives are the most trusted of professions, and that is reflected in all the Mori opinion polls. But the other thing perhaps I want to emphasise here is this piece when he says that nurses and midwives have the great potential to improve the health of communities through action on the social determinants of health. And that, and following that through, is a key aspect of our recommendations. Northern Ireland, like the rest of the UK, faces the challenges of rising demands on healthcare. This reality, as set out in Systems Not Structures, is putting enormous pressure on a system not designed to meet the changing needs of the population. There is a growing consensus that for health and social care services to become sustainable, they cannot keep doing what they have always done. Without significant transformation, it is conceivable that the entire Northern Ireland block grant would be needed to meet the rising demand being placed on health and social care. This is why the transformation of nursing and midwifery services is crucial, and why I believe the profession recognises that such transformation is required and eager to play their role in that transformation. Turning then briefly to our findings, it is perhaps unsurprising that there are a number of recurring themes. We found that poor workforce planning had impacted significantly on the morale of the profession. Indeed, this dominated many of our discussions about the role and functions of nursing and midwifery care. And as I said earlier, nurses and midwives crave the time and space to do their jobs properly and to respond to the need for change. This low morale is linked, I believe, to the fact that nursing is predominantly a Band 5 profession. And this has been compounded by both the lack of a systemic approach to role development and a reduction in core postgraduate education funding, although the latter has been offset by some transitional funding. In terms of the stability of the workforce, it is also worrying to note the substantial and increasing expenditure on agency and bank funding, with £51 million being spent per year on agency funding alone. There was also a strong sense that in the context of collective leadership, nursing and midwifery leadership needed to be strengthened right through from the point of care in the boardroom from the point of care to the boardroom. Nurses repeatedly reported not being valued and not being treated as equal members of multidisciplinary teams. In part, this again, I believe, links to the fact that nursing is predominantly a Band 5 profession. If I may, very briefly, the one recommendation that the Minister has some hesitation about is our recommendation that there should be progression opportunities, systemic progression opportunities from Band 5 to Band 6. That is the case for all other professions in the health service, allied health professions and midwives. It's not the case for nursing. I believe there is a strong case for the progression to be there, either through some kind of job evaluation, and indeed many nurses are taking on Band 6 roles already whilst being Band 5. The department wishes to look at that a bit more, the department has put some concerns in the Minister's head, if I put it that way, and they want to look at it a bit more to see if there would be a cost benefit to that. it's not just about a cost benefit, it's also about equity as well in terms of what is actually going on. So that's what the Minister was saying when he was unable to accept one of the recommendations. It's that one about the progression. He's not saying no to it, he's saying that he wishes more work to be done on that to look at the cost benefit of it. My own view is we made the strong case as it is, but there we are. And finally, there was a strong message that promoting public health and well-being of the population should be every nurse's job and every midwife's business. And approaches to public health should be normalised into the nursing and midwifery practice to impact on all ages across all settings and communities. During the course of the review, the Department's commitment to addressing the challenges facing nursing and midwifery is evident through the provision of significant transformation funding of over £50 million. This investment is contributing to safe staffing and has enabled both the growth in the number of undergraduate places and the enhancement of a range of nursing specialisms and services. This level of investment must be sustained, and the recommendations set out in our report will require the development of a costed implementation plan for this. As an economist, I recognise that it's important both to understand the value of what you do and to maximise the value of your assets. Well-respected international research demonstrates that the higher the graduate nurse to patient ratio, the lower the risk of mortality and morbidity. In addition, the new and emerging advanced roles in nursing and midwifery represent good value for money. Evidence of this is provided by the contributions already being made by advanced nurse practitioners in primary care. Also, in terms of value for money, whilst the birth rate is declining, this is now the time to invest in midwives, health visitors, school nurses, child and adolescent mental health nurses, and children's nursing. Such an investment will facilitate both the best start in life and subsequent lifestyle choices, which will serve to reduce the further burden on the health service as we go forward with the emphasis on prevention and early intervention. Midwifery and early years nursing contribute significantly also to tackling the health and well-being inequalities and that cycle of inequality. That investment is vital to break the life cycle of ill health and lack of well-being. Investment in younger people is a longer-term investment which is essential to break that cycle and to change the nature of the demands on the health service. But given the current demographics, investment in older people is also important, and that will require partnering with the independent nursing home sector. In summary, our detailed recommendations can be taken in three areas. First, there should be the adoption of a public health approach to midwifery and nursing practice, with programs introduced to facilitate that, with the placing of prevention and early intervention at the core of the nursing and midwifery professions. Public health, population health should be every nurse and midwife's job, and they should have the opportunity and time to do that. Secondly, there should be the stabilisation of the nursing and midwifery workforce, thereby ensuring safe and effective care, and as legislation allows, time allows, putting safe staffing on a statutory footing. Third, the transformation of the health and social care service through the development of enhanced roles for nurses and midwives, allowing them, through the use of those enhanced roles, to play effective and equal roles within and across multidisciplinary teams throughout the health and social care system. So there are our main recommendations that fall into those three areas. Nursing and midwifery have proud traditions as resilient professions which have been severely tested in recent times. I'm confident, and thank I'm a simple layperson here, a simple economist, so thank the input of all those nurses we spoke to and all the other members of the task group, because I'm confident that the implementation of our recommendations would not only bring about some stability to the professions, but will also ensure that nurses and midwives will be in a position to deliver improved healthcare outcomes as equal partners with other health and social care professionals. Thank you.